There are currently over 1,800 vaccine sites across the private as well as the public sectors, and over 19 million doses have been administered of both the Johnson & Johnson vaccine and the Pfizer. This is definitely a milestone, but how can people be incentivized for getting vaccinated? For more on this, I'm joined by Thato Moraba, the Chief Technical Specialist at the NGO Right to Care. Mr. Moraba, thank you for your time today. When we look at the number of doses that have been administered, what does that translate to when we're talking the actual number of people who have been vaccinated?
Yeah, thank you so much, Tammy, and good afternoon to your viewers. I think context is important, right? So we have about 39 million people that are, constituting the eligible population, so the adult population that is eligible for vaccinations. 19 million, even if you look at it in the context of the protection that it, affords the individual that have received the jab, is quite important to understand. So if you take a Pfizer vaccine, a single dose, the first dose of the Pfizer vaccine, you get up to 92% protection. The second dose really just takes it from 92% to 96%. So in the context of the number of people that have been vaccinated, it's quite important to understand that, we are moving closer to the actual herd immunity target that the government has set. And the thinking really is, how do we actually make sure that we return to some state of normality? And that can only happen if people actually present themselves for vaccinations, yeah?
So let's talk about ways of getting people to vaccinate. We've seen a number of incentives that have been put forward. We've seen, for example, in the Western Cape, the museums are allowing people to come in who have been vaccinated. There are discounts for accommodation stays. We are seeing today, a large number of those who are vaccinated and were, I guess, lucky enough to score a ticket by virtue of being vaccinated, going to watch the games today. Talk us through those type of incentives. Do they actually really work? Are people responding to these type of incentives?
Yeah, so I think the premise of it is really based on the fact that, the pandemic in itself has disrupted a lot of economic activity in the country. And we've seen a lot of partners sort of saying, how do we then help, with the little influence that we have to essentially get people vaccinated so we can actually, recover some of the losses that we've incurred in the last couple of months. And then what you're seeing is really on the basis of social behavioral change aspects. So there's a psychology to it where, for instance, you'll have someone whom a discount means a lot to. And if they see that they can actually get a discount simply on the basis of being vaccinated, it could potentially influence how they make decisions. So that's the basis of it. We've seen a lot of partners sort of come on board, really to assist, the NDOH with the efforts of getting people vaccinated. And the reason for that is, even when we did the GIS mapping, we've realized that there's certain locations where there is some vaccine hesitancy based on, various beliefs and practices and so forth. And therefore, you need to sort of tailor these incentives to really lure people into a position where they can actually really make the right decision around protecting themselves. So I personally think they work. One of the incentives that I probably got was to get vaccinated to stay on the project. So to de-risk the project, we had to get vaccinated during the healthcare worker trial. And that was an incentive enough for me to say, for me to be able to be involved in making an impact in the lives of our people, I need to get vaccinated. And there was no two way about it. So we'll probably get a sense of it this weekend. I think Bafana Bafana is playing this weekend. We'll see whether there is a massive response to that, for instance, with people that want to go to the stadiums, soccer lovers and so forth. But there's going to be quite a lot of this coming on board to really assist us deal with some of the hesitancy issues we've seen in society.
And as far as the vaccine rollout infrastructure and the improvement on that part, has that somehow helped in the increase of numbers of people getting vaccinated?
I think it has. And then I'll give you some of the numbers, right? So the EVS system was really to operationalize the vaccination program in a controlled manner. I mean, you'd imagine, for instance, if we had to vaccinate people without any control of some sort from a scheduling perspective, where we have people just rocking up at vaccine sites, particularly at the beginning of the vaccination program, it could have led to super spreader events, which could be problematic, particularly if you think about the infectious disease that we're trying to prevent and control. So you needed a system that has, very complex functionalities that allows us to control, firstly, the scheduling to make sure that sites don't necessarily stand idle. But secondly, also sort of prevent things like super spreader events. There's other modules, and I don't want to get into the details of it, but I mean, simple things like if you think about the vaccine, it has a shelf life, right? So if you don't know how many vaccines you need to send to which sites, you're probably going to end up with a lot of wastage in the system, and therefore costing the state a lot of money in terms of the procurement of these vaccines. So the stock visibility system, which is actually also within EVDS, allows you to know that I will be vaccinating, for instance, 200 people at a specific site, and therefore the last mile deliveries in that particular aspect from the cold chain then plans accordingly to make sure that there's a balance between the demand and supply. So, and that goes over and beyond. If you think about the data analytics aspect of the EVDS system, it allows us to really draw some meaningful insights to make decisions which will really progress us. And you'd have seen, I mean, just in terms of context, during the healthcare worker trial, we used the EVDS system, which is when we're actually trialing out, and managed to vaccinate about 280. And if you, by expansion, it goes to over 500,000 healthcare workers. But that was in a 3-month period, right? So we do those numbers in less than 3 days today because the EVDS system allows us to really do some solid data analytics to really inform some of the interventions that are required to see this progress further. Yeah.
And definitely the technology needs to be in place for you to even be able to do that. But thank you very much for your time.